Recording has now started. I'll kick it over to Aaliyah to kick us off with our introduction.
Yes, thanks, Ben. Good morning, everyone. So, welcome to our second session of our Issuer Office Hour. Hopefully, everyone's had a chance to look at the Zoom tips here on the screen. But just as a quick reminder, during all of our office hour sessions, um, this one being a webinar, you want to go ahead and drop any questions that you have in that Q&A box. That's the best, most efficient way to get those questions answered. All participants will be muted for this session, so refrain from raising your hand. We won't be able to call on you or anything like that. And we may drop some links in the chat, but do not use the chat. Use that Q&A box, and we'll make sure all of our panelists are able to answer your questions that way. But moving on, again, welcome. Thank you all for being here. This session is for our agents and connectors, and we have some wonderful issuer panelists on the line. So here we have some of the topics that we're going to cover today that you'll see on your left side. So we'll kick off with our Plan Year 2026 landscape, really just wanting to look at what available issuers are out there and what those drivers of federal changes have been, and then covering a few of those service areas. We'll next talk about the pre-screening tool and how you can access that through either Connect Benefits or Connect Health Coverage. Then we'll move on to our issuer developed content, where they'll present all the topics that you'll see on the right side. So those plans available, what's in or out of network, the covered services, value add benefits, tools and resources, and the best points of contact for agents and connectors to use if they have questions. And then we'll wrap up with a couple questions in a closing survey just to gauge feedback, since this is our first activity for this plan year. Then just wanted to overview the goal of today's session. So that being to highlight those available plans for this upcoming plan year. So it's weird to think that next week it'll be November, but we will kick off open enrollment on November 1. But moving on, we have our plan year 2026 landscape. So many of you all have seen this slide. We have had our in-person training sessions as well as our Connect and ACA Changes office hour. Both of those presentations and associated recordings are on KHB. This recording and presentation will also be distributed, as been mentioned. There's a lot of great links on each slide. So when we refer to those links, you will be able to click those after the presentation is available. But here we just want to review those three primary drivers of those federal changes that impact Connect. So first being the HR 1 or One Big Beautiful Bill Act. This was signed into law on July 4th and introduced a few heightened special enrollment standards, as well as revising eligibility criteria and a few other provisions that are set to be implemented over the next 3 years. And again, just calling out that not all these changes are immediate. It will happen over the next 3 years. Many of the things for this upcoming plan year 2026, have remained unchanged. These provisions did impact marketplace coverage, so Medicaid, SNAP, and a few other programs that agents and connectors help enroll residents in. And if you have any questions about what's going on with the federal shutdown or how that impacts those programs as well, we did go ahead and link some information in a fact sheet that we've linked at the bottom entitled Federal Government Shutdown Fact Sheet. So you can navigate there to answer any of your questions as well. But also moving on to our next driver is the CMS Integrity and Affordability Final Rule. This was published on June 20th, and we've linked the full rule there, but it included provisions affecting health insurance marketplaces like Connect. And because of a federal court injunction that happened on August 20th, many of those provisions were halted, or that meaning they're not currently in effect, or the date had been pushed. So we did go ahead and link those provisions as well there. And lastly, we have those enhanced premium tax credits. So HR 1 did not extend those tax credits, so they're still set to expire at the end of this year on December 31st. So if no congressional action is taken, those tax credits will expire. And at this point, approximately 85,000 residents do receive enhanced premium tax credits. So each of those residents may see premium changes depending on household size and income. Some residents may also lose financial assistance and will still be able to purchase and enroll in a full price plan, but many may see their monthly premiums increase from 50 to 100 to 500. It just depends on their income and household size as well. And again, drop in the chat or I'm sorry, in the Q&A box, any of those questions that you may have. And then here we have our issuers available for plan year 2026. And today's session will touch on just those MCOs that you see in the middle. But for QHPs, we have Ambetter, Anthem, and Passport by Molina. For vision, we have Anthem and VSP available. And for dental, we have Anthem, Best Life, and HRI Dental, or formerly Paramount Dental. Today's session will have our panelists from Aetna, Humana, Passport by Molina, United Healthcare, and WellCare speaking on their managed care organization or MCOs. All right, and although these are our QHP information, we just wanted to provide a quick overview of that landscape as well. So with those QHPs, we have some that are expanding, exiting, and contracting the Commonwealth. So Ambetter is expanding into Christian County, Molina is expanding into Bourbon County, CareSource is exiting from the Commonwealth. And with CareSource, members will receive notifications through CareSource, KHB, and receive a personal phone call as well. And then Molina is contracting from 25 counties, and we've listed all 25 on this screen here. And also just wanted to call out that Anthem will have 11 counties will have Anthem as their only issuer. All right, and we have a couple maps here, again, just noting those QHPs. Although MCOs do cover all 120 counties, we did just want to show what's going on with the QHPs. If residents lose coverage from a QHP, they can still enroll in an MCO at any time, and they do cover all 120 counties. But here we have our combined service area map, and that includes Molina, WellCare, and Anthem. If we've linked that map at the bottom there. And in our next map, we do have those Anthem service areas, which includes both the Anthem Pathway HMO and the transition HMO as well. And we've linked that here. And lastly, we have our dental service areas for plan year 2026. So Best Life, Anthem, and HRI Dental, which counties they cover and have linked it. But that's all that we'll cover for our plan year 2026 landscape. And I'll pass it over to Ben for our pre-screening tool.
Thanks, Leah, and good morning, everyone. So I just wanted to highlight the pre-screening tool once more, which is available through Connect to quickly and anonymously browse plans. So you just put in some basic information, and it's a preliminary eligibility assessment. It's not a guarantee of official eligibility. In order to do that, you would need to put on a full benefits application and all relevant household details to determine final eligibility for those individuals. The Connect Benefits pre-screening tool can be used to assess eligibility for various benefit programs such as Medicaid, SNAP, CCAP, KTAP, things of that nature. And again, just put in some preliminary information to assess and shop for or browse potential plans. And that's going to be found on the Connect website there at the top of the screen when you first navigate to the Connect website. That pre-screening tool is where you're going to want to navigate to. And then Connect Health Coverage is going to assess potential eligibility for QHPs, APTCs, and CSRs. And again, that's going to be the Connect website, connect.ky.gov/health coverage to assess potential eligibility for those programs and browse plans and get an idea of those pricings. These became available October 15th for plan year 2026. So you get a little bit of a sneak preview, so to speak, of what may be available if you want to get an idea of different offerings, what's out there to get an idea ahead of the open enrollment period. With that, I'll go ahead and kick us over to our issuer presentations. So first up, we have WellCare, and we have Darren presenting this morning. So Darren, over to you.
Hey, good morning, everybody. Wow, thank you for such a large turnout. And I get to speak today about literally one of my favorite things to talk about. That is our extra benefits that we offer Medicaid enrollees who select WellCare. Um, who's driving the presentation? There we go. Thank you. I always like to start by saying, a lot of times we get asked, how do we choose the value-added benefit, these extra perks that we offer our enrollees? And the answer is simple. I mean, we listen. We listen to you, the connectors. We listen to providers, our community partners, and our members. And we ask how can your health plan help you? And the answers, interestingly, are consistent across the board. They want better rewards for healthy behaviors. They want more activities to enrich the lives of families and children. They want tools to help their kids reach educational milestones. We know that better education leads to better health outcomes. And they're looking for weight loss programs and health coaching. And I'm really happy and excited to say that the answer to all these questions are yeah, we are including new benefits and continuing existing benefits to help reach all those ask. Next slide. So first, I'd like to start by saying some of the expanded coverage that is available to all Medicaid enrollees, and that is adult vision. Adult vision is available to all adults. They can get free glasses or contacts every 12 months with WellCare, and that includes a free eye exam every year. Members under 21 get glasses every year too. If you have kids like mine, there are basketball games and where glasses get broken or sat on or stepped on or lost on the school bus and things like that. So if that does happen, free replacements are available every year for glasses, and people under 21 also get a free eye exam. Hearing has been expanded to adults, so free hearing aids are available, and dental care also, and that's full dental care for adults in addition to children. Adults now get a second cleaning. They get dentures, implants, root canals, extractions, restoration, periodontics, literally the full complement of dental services. And dental health, hearing health, and vision health is healthcare. So I'm excited that we're able to offer that to all of our members. Next slide. One of the other asks was, incentivizing preventative care. And our preventative care program called My Health Pays does encourage people to take steps to a healthier life. We offer over $600 in healthy rewards. And the way our program works is that for every healthy activity that members complete, they earn points. Points can be redeemed for gift cards, which has always been popular, but we also have a full catalog of merchandise for our members that they can select from. And that was a really popular addition to our program last year, that people can get everything from fitness equipment, earbuds, athletic attire, grills to cook healthy meals. I mean, it is an entire catalog of merchandise that they can redeem their points for. Some like to use points to get small items really quickly, and others like to save up for larger items. And my opinion is whatever incentivizes them to take those preventive care measures is a good thing. We also will offer this year over $4,500 in value added benefits. And starting the next slide, I'm going to talk about some of those. Our most popular benefit, which is our health and wellness incentive, has been increased this year, and I think greatly improved. We are now offering $15 per member per month for health and wellness items that are available without a prescription. And the way I like to describe this is it's another full catalog of items, literally anything you could get in a drugstore outside of medicine itself. So whether that is diapers, dental care, first aid, laundry detergent, sunscreen, I mean, literally anything you would find in a drugstore is available with this benefit. And we've expanded our ways that people can redeem that monthly benefit. They can now go in store to any CVS store and select those items and pick those up there. We will also continue to make that available by online and by phone. And online and phone includes free shipping to their home. So, really excited that we've increased the amount of the benefit and increased the ways that people can redeem those monthly allocations. Next slide. Being the best version of you. Healthy weight in managing chronic conditions is so important to our health. And we offer a free 6-month Weight Watcher membership to our members. Those are available for people to go in person, but if you prefer to do that virtually, or you're not maybe close to a Weight Watchers facility or transportation's an issue, you can do that virtually as well. We also offer free health coaching, and that can be to help you lose weight, manage a condition like diabetes, strengthen your immune system, or just to feel better. And those coaches are available all days of the week and nights as well. And you can reach them via text, email, or phone. Next slide. Starting with our very youngest members and expectant parents, we want to make sure that maternal health and newborn health is absolutely taken care of. And one way to do that is making sure that they have access not only to their healthcare providers, but to their social network and family as well. So we offer a free phone with unlimited talk, text, and data for those pregnant members. We also offer, for those that complete their prenatal visits, their choice of a stroller, playpen, car seat, or 6-pack of diapers. We have a Text for Baby program that starts from the beginning of pregnancy all the way through the first year of life, providing links and tips to a number of really helpful resources. And then again, if you're like me, there are always questions, during my wife's pregnancy and during that first year of life, and you want to reach somebody. Do I need to go to the ER, or just, what do I do if someone's sick? And we have a 24-hour nurse advice line that is a great resource to help people with those types of questions. Next slide. As our members enter their younger years, we want to make sure that all their educational needs are being met. We have a free tutoring program that allows 12 free 1-hour sessions to our younger members. Those sessions are available to people in person or online. And another really great announcement with that program is it's expanded to also include SAT and SAT college prep courses as well. So that's just another way that that program has been expanded, and it's been extremely popular with helping kids catch up or get ahead. We know that internet is such an integral part of education. A lot of assignments and communication are sent via email and need access. So for those areas that lack broadband access, we offer a free 12-month internet service, and that includes the hotspot as well. We offer a free GED program for our members. And we also offer 50 $1,000 scholarships to our members. This is another example of listening to our wonderful connectors. And we changed this to not only a college scholarship, but also to make that available for trade schools, which is a fantastic, career path for people. We want to support that as well. And then for our younger members, pre-K through 5, we have a great reading program, again, to strengthen those skills and make sure that people are caught up and are getting the best education possible. After hours, we know that healthy kids or active kids are healthy kids. So we offer programs like the Girl Scouts and Boy Scouts of America. We have free membership for those kids. We also extend that membership to parents or guardians that want to be involved in their kids' troops. And we include for the kids $25 every year towards the cost of a uniform. We also offer free sports physicals to our kids um, uh, throughout their younger years. Somebody asked me an excellent question last year, and that was, what is the difference between the sports physical and the yearly physical since they get that? Well, if your child has a annual well check in, say, June, and then it's August and they want to join um, uh, football or field hockey or something like that, they wouldn't be able to get another well check. So the sports physical is able to fulfill that need without any additional expense to the family. Next slide. As you grow up and you enter the workforce, we have a lot of great resources for members as well. Our state issued ID card, and this one's very near and dear to my heart. This was something I brought to our leadership team. And you may scratch your head for a second and say, well, what does a official state ID have to do with healthcare? Well, without an ID, you can't rent an apartment, you can't open a checking account, you can't get a job, you can't get a loan. So many things that official state ID is needed. An unintended but wonderful benefit that happened was that we found a lot of our unhoused members, once they got their state issued ID, could use that shelter as an address, and they were able to get other benefits, such as Social Security payments, mailed to those addresses. So that opened up the door to another benefit by having that state issued ID. We have a wonderful collection of job training and job placement programs through Steps to Success and WellCare Works. WellCare Works has a lot of great online tools to help people craft resumes, create cover letters, to understand, how to prepare for interviews. And this year and next year, we've opened up now that they can have job coaching via the phone. So that's going to be a wonderful resource as well that is available at no cost. We want to make sure that we remove any barriers for people that are trying to look for employment. So we offer criminal record expungements for nonviolent offenses as well. We also offer consultation. That's a really short window of 30 days once that process begins. And if you don't navigate it quickly, you can miss out. So that's another important component. And then we also offer a free cell phone with unlimited talk and a large amount of data. A lot of us use that federal program to provide the cell phone service to our members. Those benefits have decreased, and a lot of places now do charge for the phone, but WellCare is waiving that cost. We're absorbing that so to make sure that people not only get the service, but a free cell phone in 2026. Next slide. This is actually a wonderful benefit that is open to everybody in the state of Kentucky, whether they're a WellCare member or not. We have our Community Connections helpline, and we encourage people to call up whether they need assistance with rent, utilities, childcare assistance, legal services. We actively go out in our communities and collect and maintain a database of thousands of federal, state, local, and hyper-local resources. When people call in, we literally have resources available 99.4% of the time. And for those zero point 0.6 that we don't, we get back to them on average within 4 hours. We take the time to talk to people because if someone is worried about food insecurity, for example, we realize there's probably other problems. So on average, we fulfill up to 3 needs per call. And this is a wonderful service. And again, this is at no cost and available to anybody in the state. So we encourage you to share this number with all the people that you work with. Next slide. We're here to help. We obviously have our member services that's available, but we also have a 24-hour crisis line if anybody is experiencing um, drug and alcohol abuse, behavioral health, domestic violence emergencies, anything on that in those purview. Please, we want to make sure that we're available at all times for our members. I just talked about our Community Connections helpline. And then we also have a meal program that's available for people after they're being discharged. to make sure that they have healthy meals for several days after the discharge. Again, making sure that they are taken care of and don't have to return for additional care just because of food insecurity. Next slide. So, wrapping up, we really feel that 2026 is going to be a great year for the state of Kentucky. We offer for children and adults a full complement of dental care, hearing, and vision. We have our improved health and wellness program that's going to have $15 for every member every month that is available in store, on phone, or online. My Health Pays, $600+ available for preventative care incentives. We offer Weight Watchers and healthy coaching to make sure that people um, are maintaining healthy lifestyles. We have full complement of programs, making sure that people have strong maternal health and support for their newborns. All those great activities to support education and outside activities to our younger members, and then the great resources that we offer our adult members, making sure that they're living productive and healthy lives. So um, that is my song and dance today. I also like to remind everybody that the rules changed a while back, and now that in Medicaid enrollees can switch their plans at any time throughout the year. So for those WellCare members, we thank them. Anybody else that is interested in our 4,500 plus value-added benefits, that they can switch to WellCare if they so desire. So. If there's any questions, I'm not sure if I can take those now or if I need to respond to those later.
Hey, Darren, yeah, we got a question in the Q&A if you want to respond there. Like,
Okay. Let's see here. I see a question here about the IDs. Would that pertain to reentry folks as well? Yes, absolutely. In fact, we're working with reentry to make sure that that is available as they exit the penal system. So that that again removes another barrier so that they can rent an apartment. They won't be able to do that or get a job and whatnot without that. So yes, absolutely. Will this MCO plan be available in Jefferson County? We are available in all 120 counties throughout the state. I see another question about our rehab facilities. We have coverage throughout all 120 counties, fully compliant with state requirements. So we treat behavioral health very seriously. We want to make sure that they are receiving services in valuable services that are available to them. So we are absolutely compliant in there. And is there an extra benefits flyer information? That is currently with the state being approved. And just as soon as that is ready, we will share that out with all of you. Those will also be posted on wellcareky.com. Again, let's see if there was one more question. I still have a minute. Some unhoused are not allowed to use the shelter address when trying to get a phone. Is that going to be an issue with WellCare? Um, if you have a specific shelter where that's not available, let us know because they should be able to do that. We will need to ship them somewhere. So we will need an address. So either if that's an issue, just yeah, contact us and we will work through a way to get that phone in their hands. Um, any suggestions for those needing dental services having trouble finding providers? I mean, that is an issue that is true for a lot of people. We do have resources if there's not a provider in that area. We do have everybody within the radius, but we can provide transportation at no cost to make sure that they can find a Medicaid provider. Okay. And someone told me the Salvation Army in Bowling Green does not allow them to use their address. We will reach out to them and see if we can't make that work. Expungement process, that's a probably longer than I have. If you want to send a question to my email, I'll be happy to respond that to you. Okay.
Thank you, Darren. Appreciate it.
All right. Thank you. Thank you for the time and those wonderful questions. Really
Absolutely.
good.
All righty. Looking up next, we've got Etna. I believe we've got Candace here presenting today.
Good morning. Good morning. Can you guys hear me?
We sure can.
All right. Okay. So whenever you guys pull up my presentation, I'll be ready to go. Or do I need to share my screen?
We are currently sharing.
Oh, maybe I am just don't have the right view here. There we go. All right. Well, my name is Candace Gurley, and I'm the Senior Manager of Community Development for and Outreach for Aetna Better Health of Kentucky. And as you guys can see, my email information is set here on the screen. So if you guys do need to reach out to me at a later date, you can definitely access me that way. Aetna Better Health of Kentucky is part of Aetna and the CVS family, which is one of the country's leading healthcare organizations. So Aetna and CVS has been serving people who use Medicaid services for over 30 years, from kids, adults, seniors, to people with disabilities or other serious health issues. Next slide, please. So, of course, they've been in the market, since managed care inception. The Kentucky team is nearly over 300 employees that are closely connected to the community that we serve, really focused on a holistic approach, including a suite of innovative value-added benefits and that really prioritize total health. So we'll talk about those as we move forward. Next slide, please. Just sharing that, Aetna achieved excellent in healthcare quality by empowering members across the continuum to really engage in their physical and psychosocial well-being and improve the health outcomes. So in 2023, the healthcare became the sole Medicaid plan to receive a 4-star rating. Next slide, please. All right. This here just really gives you a snapshot of our population. Won't necessarily go over that, but we'll let you take a look at that for future reference. Next slide, please. So not only does Aetna Better Health of Kentucky provide traditional Medicaid benefits, Aetna was also selected to manage the state's new Supporting Kentucky Youth Program, also known as the SKY program. So this means that children that are enrolled in SKY receive their Medicaid coverage through Aetna. So in addition to covering Medicaid benefits, SKY provides a high-touch approach to care management, and this really helps families to navigate the system and make it easier to get resources that they need. Next slide, please. All right. And this is, again, just a snapshot of the member population in distribution. Next slide. The next slide really just focuses on Aetna Better Health priorities of health, which is our SKY program, member engagement, health outcomes, maternal and child health, as well as social needs. Next slide. This slide here is also a quick reference for contact information, as they did state that this slide deck will be shared. So again, this information is for your reference, a quick way to be able to contact and receive information that you might need. Next slide. We also want to make sure that we have several ways in which the member can access, and that anyone that is assisting our members within the community to be able to access information. And we provide that through a member handbook. We also have an online portal. Members are encouraged to download the Aetna mobile app. And of course, we do have the website that is available. Next slide. As we move through, as we move through working with the community and working with members, we do want to encourage that as you are working with individuals that we want them to maintain their Medicaid coverage. And by doing that, we want them to we want you guys to encourage our members to stay in touch, to again, to share the most up-to-date contact information. And if that was to change, to stay in touch by, again, ensuring that we have that most up-to-date information so that there is no disruption in benefits, and then to ensure that they receive all benefits that are available to them. Next slide, please. What is covered? Of course, we think of the traditional Medicaid covered benefits. So for medical, and I'll let you guys read this all the way down to population health. And again, in the slide deck, the member handbook, as well as our Sky member handbook, is a live link. Next slide. All right. So in case of an emergency, you may see any Medicaid provider. Next slide. All right. Oh, I'm getting a little ahead of myself. So for what is covered. So again, these are our traditional Medicaid covered services here that are listed. And again, these links on the slide are live. Next slide. All right. And the Better Health of Kentucky is definitely going to provide case management support. Members get the one-on-one outreach to assist them, throughout their healthcare journey. Please see the programs that are listed here. From our our care management ER initiative, even to our CPSEN program that connects members with their pharmacists who perform medication reconciliation. So again, being able to provide that additional support as members go through. If a member is interested in case management, they can call in themselves, and you can also make referrals for those members through several of the previous ways in which members can reach out, whether that's through the website, calling into our member services line, or putting requests in through the mobile app. Next slide. All right, now moving on to our rewards programs. So Aetna Better Healthcare does have its rewards programs that are exclusive for healthy behaviors like completing a mammogram, dental exam. And so we really do not want our members to miss out on these. These programs or incentives require no action on behalf of the member to receive these benefits that we'll go over in just a few minutes. So they'll automatically send out a gift card that follows the doctor's appointment. So again, that's why it is very important that you encourage folks that you guys are working with to have that information most up to date so they're not missing out on any of the benefits. Next slide, please. All right, so our rewards program consists of gift cards. Again, these do not require the member to confirm. They do not require the member to call in, but we do have to have a valid shipping address to receive the benefits. So following your doctor's appointment, the person could receive a call from our RVR system, and these benefits would confirm the address so that the benefit again can be released. From $10 completion of dilated retinal eye exam, mental health practitioner follow-up, annual well child visits, as well as completion of metabolic screening. As you can see, I have also listed, again for future reference, just some of the additional criteria and things of that nature here that you guys can begin to take a look at. But again, these are the Better Care Rewards program that do not require any additional follow-up other than ensuring that the mailing address is valid. Next slide, please. Some additional rewards include our $25 completion for HPV, our infant flu shot follow-up for $25, completion of the HRA, as well as the $50 for completion of 6 well child visits before 15 months. And again, you can see the eligibility and criteria that is, that is listed here. Next slide, please. And again, just some additional rewards here from the completion of the A1C test, mammogram, and Pap test. Again, $50 gift card rewards that could be pretty useful. Next slide, please. As stated before, Aetna does have the Sky line of business where we do provide those benefits for the individuals or members that are DCBS, DJJ, adoptive or formerly adoptive youth within those plans. These there are some specific rewards to that population, which is $25 for completion of a dental exam as well as the vision exam. Next slide, please. All right, next slide, please. All right, moving into our no-cost benefits and services. Now, for these additional benefits, there would be a required call into our member services line to request these additional services. And as you can see, our member line is available 7A to 7P. Next slide, please. All right, and some of these additional benefits include the over-the-counter benefit with the $15 monthly stipend covering over-the-counter benefits. And so again, these benefits don't roll over. So we encourage members that have this benefits to have that benefit to utilize the full $15. That benefit can be ordered online, as well as through our CVS stores. We do have a over-the-counter period promise where females in regions 2, 3, 4, and 5, ages 15 to 55, receive $20 monthly stipend on period products. We also have a Pacify tech-enabled platform that provides 24/7 perinatal and infant feeding support to new and expecting parents via their smartphones. Next slide. All right. Also offering remote patient monitoring through Vita Health, which is telehealth monitoring that provides members living with certain chronic conditions, education, and self-management tools to help. It's a 9 to 12-month program. Also offering home delivered meals for members with certain chronic conditions that are post-discharge, up to 4 to 12 weeks of, 4 to 12 weeks of nutrition education, as well as 10 round trips of transportation up to 60 miles total within a year, such as job interviews, training, shoppings, and things of that nature. Next slide. All right. Also offering PICS, which is an adult and youth member who experience loneliness, can assess our PICS health platform. So really provides member engagement and addresses some of the loneliness that our members are experiencing, as well as our blood pressure cuff program, with members with diabetes or high blood pressure can receive a blood pressure cuff to monitor their health at home. Next slide. All right. And so we also have a back to school assistance program, basically where members are eligible to receive a backpack that are school age with school supplies, with the difference between teen and youth. Also a $50 gift card for participants in after school programs is general, so can be used with several organizations like Big Brother, Big Sister, Girl Scouts, Boys and Girls Club, etc. Next slide. All right. We also have a opioid lockback program to keep members that have opioid prescriptions safe, along with a $40 gift card to assist with certification fees tied to criminal expungement records. So that's a $40 gift card to help start that process. Next slide, please. All right. Next is our Maternity Matters program. To receive these benefits, please call our member services from 7A to 7P. Next slide. All right. And our Maternity Matters program consists of $25 completion of initial prenatal visit, $10 for prenatal visit, for follow-up prenatal visits, postpartum visits, and we also offer cribs or a choice of a car seat for moms that participate in our Maternity Matters program. Next slide, please. All right. And these next rewards are specific to our Sky population only. Next slide. All right. We do offer some assistance around tattoo removal, driver's license fees, moving expenses, as well as a birthday in a box. Not all the time. Our members that are in our Sky program get to celebrate birthdays. So one of the things that Aetna does is provide a birthday box for our Sky members. That is an additional benefit. Next slide. All right. We also have common comfort. So members that have experienced adverse childhood experiences with anxiety, things of that nature, they can get supplies to help with the impact of that trauma. That includes things like sound machines, weighted sensory plush things, aromatherapy, light therapy products, but again, a way to help calm our kiddos that might have experienced some ACEs in their past. Also offering a foster care duffel program. So we provide a personal duffel bag filled with personal hygiene items and supplies and blankets to our Sky members whose placement have changed from one home or another and things of that nature. So that does provide them with an immediate source of resource while they are getting settled in the new placement. Next slide, please. All right. Also offering language services here. So Sky members who have been identified as deaf or hard of hearing, but we're seeing a screening. Then as well as a gym membership, so a $200 gift card to pay for memberships within gyms or areas around them. Next slide. Also allow smartphones ages 13 to 17 and laptops. Next slide. Right. We also have some local training and events pages that are open. Please click this link and you will be able to click on all free trainings that could be appropriate not only for members, families, and even caregivers, ranging from power struggles, de-escalation, for personal and professional relationships, as well as parenting classes, things about nutrition and such of that nature. So please feel free to click that link. Next slide. All right. And again, these are active links, our member handbook and guide that will take you directly to our page so you can reference any of the information that I had stated today. Next slide. All right. And any questions that you guys might have for me?
Thank you, Candace. If you want to reference the Q&A box for any sort of outstanding questions related to Aetna.
See my webinar chat.
All right. That will move us into Humana. And I believe we have Jan Breda on this morning to talk through this. Jan Breda, over to you.
All right. Good morning, everybody. I'm Yambretta Stewart. I am the manager for the community engagement and outreach team for Humana Healthy Horizons in Kentucky. Picture me. Yep. So Humana. We, of course, everybody knows us as Kentucky Medicaid, but our name has changed, Humana Healthy Horizons in Kentucky. We provide healthcare coverage for all eligible individuals, including children, seniors, disabled adults, and pregnant women. It offers, of course, we have a large network of doctors and services for all 120 counties, and ways that we're able to do this for our benefits, and talking with our benefits, you get Medicaid, everyday benefits, rewards, and support. And what we do is we channel our members by getting feedback through our QMAC sessions, which are Quality Member Access Committee. And so we love to get a feedback, good, bad, and different. And we make sure that we take that feedback and we resolve issues. We address issues, address any concerns for our members, but they also provide suggestions on new benefits, what would be great for them, what's working, what's not working. And so we accept that feedback and take that feedback and move that into new benefits that we may offer. Also, Humana was just awarded NCQA 4-star for 2025. Next slide. Of course, these are all the covered benefits, medical, which pretty much is covered by all Medicaid plans. But if we go to the next slide, we'll talk about our covered services for dental, hearing, and vision. So for dental, I like to call out for enrollees younger than 21. We cover the one set of standard x-rays every 12 months and then 2 cleanings every 12 months. Our members over 21, 1 cleaning every 12 months plus 1 additional cleaning. And then also 1 set of standard x-rays every 12 months. Hearing, we do cover 1 complete hearing evaluation per year, hearing aids up to 1,200 every 36 months, 3 follow-up visits within 6 months, and then 1 additional follow-up visit within 6 months following the hearing aid fitting. For vision, all enrollees receive the vision exam and then contact lenses if necessary. And then enrollees younger than 21, 1 pair of glasses every year, and then an additional pair, which I know I've had to use for my son as well. So we cover 1 additional pair if the pair is lost, broken, or the prescription changes. Next slide, please. Okay. So value-added benefits, and I think a slide is missing. And I'll just speak to it. We offer several incentives for our rewards program. It's under our Go 365, and it's for all. We encourage healthy activity, making sure that our members are getting their wellness visits, breast cancer screenings, cervical cancer, colorectal cancer screenings. And so we offer rewards for such screenings, the health risk assessment, HPV vaccine, postpartum visits, prenatal visits, well child visits. And so we offer up to, a little bit over $600 in rewards for making sure that our members get their benefits of going to their wellness visits. So the value-added benefits. So Humana does have a Humana Beginnings program. It's pregnant up to 3 months after delivery, helps you access benefits and Go 365, and provides care management team to help you before and after birth. So we offer 2 pre-cooked meals per day for 10 weeks for the pregnant members who are high risk. Also for pregnant members who enroll in the program and actively participate, and do the assessment and do the follow-up call, they are able to select either a car seat or a portable crib. And then also we offer doula services. So doula assistance for the 5 prenatal visits, 3 postpartum, and 1 visit for delivery assistance per pregnancy. And so our care management team is there to educate and support, help understand benefits, referrals for other treatments or community services after the baby, coordination with hospital, again, continuing that education and support, and family planning. And they also do receive a free breast pump. Next slide. Okay. So we also offer criminal expungement. It's for members 18 and over. It's up to $340 for the expungement, and funds will not be paid directly to the member. We do follow up once the services have been rendered and paid directly to the courts. We have GED testing as well. They can sign up through the GED Works online. And then also we have smartphones for Humana members who qualify. We provide the free smartphone with the monthly talk minutes, text, and data. And all of that can be access through member services with that phone number. Next, we talk about disaster preparedness meals. So for disaster, if it's considered a disaster, we cover services at out-of-network hospitals and other medical facilities. Also replacing lost prescriptions, and then stop the need for PCP referrals in the event of a disaster. So they get one box of 14 shelf-stable meals twice per year, and the member must not live in a residential or nursing facility. Post-discharge meals for any members that are coming out of the hospital, or pregnant members. If you're having surgery, you can get 14 refrigerated home delivered meals following discharge of an inpatient or residential facility, and that's limited to 4 times per year. And then lastly, talked about this, it's post-discharge as well as a smartphone. Next slide, please. Housing assistance. So we do have a housing assistance benefit where we will assist with apartment rent or mortgage payment if they're behind, utility payment for electric, water, or gas, trailer park or lot rent if this is your permanent address, and all have to require a late payment notice. We will up to $350 per member per year provide that benefit, and the payment is paid directly to the landlord. And we also cover moving expenses via licensed moving company when transitioning from a public housing authority. So the member must not live in a residential facility or nursing facility. Funds will not be paid directly to the member. And also, if the bill is in the spouse's name, a marriage certificate may be submitted as proof. We also offer a workforce development program. So for members 18 and older for 12 months, we do offer such things as job support, retention coaching. We provide 3 round-trip bus vouchers for transportation. And also we do reimburse for childcare up to $40 per quarter, up to 4 times per year for caretakers seeking opportunities. And members must participate in the Humana workforce program in order to be eligible for reimbursement consideration. So we do offer several benefits for our kids. So one is a haircut. So we do offer one standard haircut, $20, and that's per quarter. So we'll reimburse up to $40 for the haircuts. All they have to do is redeem it through Go365, provide, upload a photo of their school registration form, school ID, or class schedule, and we'll reimburse up to $20 through the periods of either March through April or July through September. We also offer youth academic support. So it's going to be through tutor.com, and we'll be able to offer for 5 to 18 up to 20 hours of tutoring available over a 10-week period each year. Next, we offer youth development and recreation. This is for our members that are 4 to 18, and we'll reimburse up to $250 per year for any participation in activities such as YMCA, swim lessons, computer coding classes, music lessons, but pretty much any lessons, any activity that they are charged for, athletic activity, will reimburse up to $250. And then also we do cover the one sports physical per year for members 6 to 18 with the in-network provider. And so I did provide a list of resources from our member services, care management, our Kentucky Pop Health, which is responsible for the housing assistance and other benefits such as tutor.com, GED. I have the prior auth intake, Humana First, behavior health, DentaQuest, and then also iQuest as well. And I do want to highlight that for Humana, we also have a Humana Community Navigator. What that does is it houses all of our community-based organizations and the referrals and services that they offer. So to be able to meet the SDOH needs and also to be able to provide referrals to these organizations. Does anybody have any questions for me? And I have also included my contact information, my email address, as well as my cell.
Thank you so much, young Bretta. And if you want to reference the Q&A there as well, if there's any sort of outstanding questions, you can respond there. But thank you so much.
Thank you. For care rewards, once the appointment is done, the member super call. Okay, that's it. And will Humana be available? Yes, Humana is available in all 120 counties, including Jefferson and Bullitt.
Thanks, young Bretta.
All right, thank you.
All right, looking next, we've got Passport by Melina. So we got Nicole, I believe, on the line.
Yes. Hi.
Over to you, Nicole. Thank you.
Good. Thank you. And thank you for this opportunity. I get to see a lot of my colleagues here today that I work with. We really don't see this. We kind of do, but don't as competition because we're all here for the same purpose, and that is to make sure that our members get the access that they deserve. So hello to all of my friends here. As you know, at Passport, we've been around for 27, 28 years. And we strive to meet the physical, social, and emotional needs of each of our members. And this is our mission statement. And the next slide. So what we've done here, we wanted you to see the pages of what it looks like if you go on our website and how you can learn more about the benefits as a member. So these first 3 pages show you all of our what you can look for here, our member information. So if you want to go to the next slide and the next one. All right, and then this one here, it talks about the benefits, and more of those are healthy rewards here. So school and sports physicals. And if you click on the little plus sign to the right, you can see what those benefits are. And then, yeah, here we go. All right, so on this slide is how you would find your provider or the hospital. So we have all of these categories here: urgent care, and the medical equipment, supplies, all of the things you might need as our members, you can find here on this section of the website. And then if you go to the next slide, the bottom part here is where you can find it's the doctor's page. It includes pharmacy, dental, and vision so that you can find a physician. So if you wanted to click on dental, it would help you go that way. All right, and then this slide here is when you click on the dental, it goes to DentaQuest. So we just did that as an example so that you could see one, and then that's our current dental provider. And then you can locate the provider in your area. And so our next slide is the March Vision. And so that's who our vision provider is, and it will help you locate. We just thought it was really important so you could see on the website how you can find all of your providers and what you're looking for. All right, and then on the next slide, these are our healthy rewards. So the next 4 slides will show you all of the healthy rewards, the gift cards, and I'm kind of scanning because the others have told you a little bit, so you understand what that looks like. So if you get a colon cancer screening test, it's a $25 gift card. And then case management is 25. So these are all of our healthy rewards that our members can get when they do their visits. So the next slide shows you more. And the next one is the same. All right, and I believe that's let's see. Okay, yep. And then the next slide. All right, so this is our healthy rewards, the front side of a flyer, and we share this at events with our CBOs and FBOs, and so that you can see what the healthy rewards are. And then the next slide is the back of the flyer. Right, give you a minute there, so it tells you all the things. Yep, and then this is, no, you're fine to keep going. And then this is another flyer that we use, and the example, it shows you the retailers that you can use your rewards at. And that's on the bottom there to the right. And then the next slide is the back page of that flyer, just showing you the information that we give to our members. And then the next slide is, so we also offer member education sessions weekly. They're virtual and in person at our one-stop help centers, and you'll learn more about those coming up. And we educate our members about our benefits. And so you don't even have to RSVP to those. You can just get online or show up. It shows you our one-stops. We have 6 of them. Louisville is now open. So that means we need to update this one. And then this is the back side of the flyer. Okay, and this is our healthy rewards assessment that we have, and the members can print or get copies of it to take to their providers so that they can get their healthy rewards. So you can get all of this on our website. And the next one that shows our member cards, and so you can print that off. It's the ID card. And then it just shows you like where your ID information is, your PCP, the pharmacy, all of the things that you may. And so these are flyers that we pass out so that our members are aware of what to look for on their ID card. And then the next slide is how to get the interpreter services and the number and how that works, how to make an appointment. You can talk to a doctor, get information about how to take your medicine, all of those. And this is a flyer that we pass out as well. And then the next slide. So this is the Weight Watchers referral form that we wanted to share with you. Members can print this off as needed. And then turn that in and get their reward for it. All right, and then the next slide is, this is our member handbook. So you can also access that. You can request one or you can get it online and take a look at that. And so that it will answer any of the questions you may have about your benefits. And this is the PDF version that you can also print at home if you wanted to. And then the next slide is where to go if you needed something. So if you have a headache, if you have a skin rash, where do you go if these things should occur? And then the next slide shows our transportation slide and our flyer. And this is a flyer that we pass out to all of our members so that if you have transportation needs, you can see where to get those. And it's important to note that it's sometimes it's a 72-hour in advance of that you need to schedule your transportation. And then the next slide shows our free wireless service and what that offers and how you can determine which one you qualify for. You can sign up today. We use True Connect. And then the next one is the maternity care flyer. So we talk about that. We host a lot of baby showers. We attend a lot of baby showers in the community. And so that is how we share information with our expectant mothers, and help them to get the care they need. So what's important is, how to determine high risk pregnancy. We encourage you to quit smoking. How do you get WIC? All of those benefits. And then the next flyer is another about educating routine testing during pregnancy. We also, I don't know if they'll have it in here, but we also have magnets for new moms that we pass out at events. And then the next slide should be about Teledoc. Yes. And so Teledoc, you can skip, a trip to the ER if you were too sick to go, and how you can talk to a doctor by phone or video. And these are also flyers that we pass out at events so that our members are aware, so they can pick up any of this stuff wherever you find us. And the next one is our flyer on the quit smoking information. So lots of information there on how you can quit smoking, the benefits of not smoking. And all of this is, available to our members, how to get vaccinated. Yep. So that they understand what the rewards are. So it tells you the gift cards on here, and then influenza, you can get $100 gift card. So they can stack up. And then this is the back side of the vaccinated get reward flyer. All right, and then the next slide. So I talked about our one-stop help centers. And so we now have 6 of those. The Louisville one was opened in June. And those are in Owensboro, Bowling Green, Lexington, Covington, Hazard, and now Louisville. So that one in Region 3, like I said, we just opened that in June. And then finally, this is our team. And so it tells you what areas they are in and what areas they cover. And then the back side, and I probably forgot to introduce myself. I am the AVP of Growth and Community Engagement for Passport by Melina. And then the next slide is where we're located and all of the counties that we serve. All right, and I believe that's the end.
Yes, it is. Thank you, Nicole.
Got a 9-minute warning, so I think I need that unless there's some questions.
Absolutely. Yeah, if you want to reference the Q&A box there for any sort of outstanding questions
Extra
or
benefits automatically sent when they complete on the exercises, or do they have to call? So you have to fill out the attestation form that you did it. And so take it with you and then send that in and you can get it. Oh, and will 2026 be the same? They will probably be just a little different. We've been working on trying to get some things added. Every year in this business, you assess what works and what doesn't work. And so we've been doing that. For transportation, do they call the MCO directly? Because in the past, we called the bus van and they set it up. I'm just wondering what to tell the client patients. Yes, so they can call the MCO, and then I don't know, let's see if we can go back to the transportation slide. There's a number on the transportation slide that you can call. Let's see. Right there. And so it gives you a number to call. All right. Is that all I think I answered all the questions? Maybe.
yeah, it looks to be. Thank
Okay.
you, Nicole.
All right. Thank you for this opportunity and time.
Yeah, absolutely. Thank you for your time.
You're welcome.
All right, looking next at our United Healthcare, and I believe we have Shannon here. Do we have Shannon or Whitney here? Or anyone else from United Healthcare? Alrighty. If not, we can go ahead and talk through some of these. But just an introduction of United Healthcare, their mission and vision statements included here. And then in terms of their redeterminations, some of those offerings and the processes of going about that, how to be able to find a connector in your area, and important dates, some of the flyer information that they distribute. For their network, they've got a provider network link that you can leverage to be able to search for providers in your local community located on their website. For their covered services, again, you'll be familiar with those regular medical checkings, immunizations, family planning, preventative care, etc. For their value add benefits, do offer some transportation services and 24 free one-way trips to community and medical services, some maternal care and infant care with diapers and wipes for babies, car seats, strollers, pack and plays. Also have a Healthy First Steps program for pregnant moms and their babies. Also offer services for their doulas for those who choose to go that route, and then participate in the Boys and Girls Clubs as well, and provides that membership for after school care. Additionally, they also offer home and delivered meals, 14 home delivered meals for members who meet those associated eligibility requirements, over-the-counter healthy and food services, which are up to $100 per year for over-the-counter products and healthy food options. Also offer GED Works program for coaching or preparatory work and testing for members who are 18 or over who want to get that diploma. And then for gift cards and participation, $50 for that, for participation in those quarterly member access committee meetings, which we'll highlight here in just a few slides. For a gym membership, we have a free gym membership for members with diabetes, and then criminal expungement offering as well, $175 reimbursement for those members who meet eligibility criteria for expungement services. We also offer, or they also offer acupuncture as well, 30 visits for members 18 and over with lower back pain or migraine diagnoses. On My Way program, which is a free, engaging, and interactive program that informs Kentucky youth, helps prepare them for real-world situations. The Well Hop program is an online conversation fun tool that helps women get ready for their baby and expectant mothers, and a 24/7 doctor chat service for those telehealth services that members can call if and when needed. And then the United Healthcare Healthier Lives helps with finding various community resources that they may need, such as food banks, shelters, clothing, so on and so forth. And again, the Boys and Girls Scouts yearly memberships there for members for their uniforms, those ages 5 to 18. For the member programs and benefits, Healthy Rewards, they can get gift cards for completing those various services on a yearly basis. Smoking cessation offerings as well to help people stop smoking and or dipping or vaping. Equine and music therapy services as well, 12 sessions for members under 21 for that. A respiratory kit for those with asthma or COPD, and associated products for that, such as pillowcases, blankets, etc. Calm Health is an app for personalized evidence-based behavioral health support that members can leverage for those behavioral health services if need be, as well as Mindula a social and mental health support for those with SUD or OUD. And then finally here, some free cell phone services as well, where the eligible members can get no-cost mobile phones for them with talk, text, and data rates as well. So looking here next at more specifically related to maternal health support and associated programs, the maternal health programs to help expectant mothers and babies. And you'll see here a list of some of those services that are available for that, such as a Healthy First Steps program, doula services that we spoke about, prenatal care, various community services, breast pumps, transportation services, breastfeeding resources. So lots of available offerings here for maternal health and associated needs there. Looking next at diabetes and some of the offerings that they have available for the diabetic population. They have various programs and case management services for those who have diabetes to help manage that. And so you'll see here testing and monitoring, healthy eating, members, tools, and services, which include various programs and offerings to help support those members who struggle with diabetes. And then you'll see here on the right-hand side, there is a QR code that you can scan with your phone. So if you pull up your mobile phone, put your camera on that, and you can download that United Healthcare app and get those additional details on your mobile device. Also have a partnership with the Goodwill Opportunity Accelerator Program, and so you'll see that highlighted here, what it is, and the locations across the Commonwealth that you can see there on the right-hand side. So if you're interested in participating there or getting involved there, you can reference this for more information. And again, we'll distribute this slide deck afterwards for ongoing reference if anyone wants any sort of additional information as needed. And then here is just a map graphic of those locations across Kentucky. So you'll see there the Goodwill Industries Opportunity Centers, as well as those Goodwill Industries of Kentucky retail stores as well. So you'll see that map graphic there where they're located in the respective cities across the Commonwealth. Looking at tools and resources, they've got that United Healthcare mobile application that I just spoke about that you can download to your mobile device. Of course, a website for additional information, that 24/7 nurse line. So if you have a urgent need and don't know what to do, where you should go, can call that, as well as a doctor chat available as well. For those member resources, members will receive a care management program, mailing, first steps, hands, non-emergency medical transportation, application assistance for those with SSI or SSDI and substance use hotline as well. So I mentioned earlier the quarterly member advisory committee. So that's what is highlighted here. And that next meeting is going to be December 9th from noon until 1 p.m. Now, this is an online offering only. The purpose is to allow committee members to provide feedback and insights about services and experiences. So again, always want to listen to the members, their feedback, and incorporate that. And in participating members can earn up to a $50 Walmart gift card if they were to attend these sessions. And again, next one being December 9th, noon to 1. For points of contact, you can contact these individuals listed here, Craig, Lisa, or Shannon, for additional questions that you all may have. And finally here, how to access that member services number is included here that you can call. Those hours are 7 a.m. to 7 p.m. Eastern Standard Time for member services. That will bring us to our closing section here for today's session, which will be our closing survey. Just a couple of questions that we wanted to ask the group here as we close out. First question here is assessing whether, on a scale of 1 to 5, how effective you found today's presentation and helping you better understand those available plan offerings for plan year 2026. So let me launch this to your screens now and give you a minute here to select a response. And as you all do so, panelists, anyone have any um, questions that they saw come through that they want to voice over for the group, or anything to highlight as we receive responses here to our first poll question? And about 20 more seconds here for this first poll, and then we'll have just one more as we close out. All right, let me get this closed out here and share those results with the group. Sharing now, and thank you all for participating. Looks like over 90% feeling that it was either extremely effective or effective. So thank you all for participating there. Our second poll question is geared towards your comfortability with helping residents enroll in coverage and how effective you thought that this office hour was in terms of helping you feel prepared for that. So again, let me launch this to your screens now. And again, give you about a minute here to answer this second and final poll question today. About 30 more seconds here for our final poll question. If you haven't yet, please select answer choice here. Should be available on your screen. Okay, let me get this closed out. And again, once more, share those results with the group. Over 80% feeling as though it was feeling extremely prepared or prepared, which is great to hear. So thank you all for participating there. And let me move this. And that will bring us to our concluding slide here. So first, want to thank the panelists today for their time and contributions and taking a little bit of time as we're in a busy season to highlight their plans and some of those offerings, and to our agents and connectors for hopping on with us as well to learn more about those various plans and the issuer offerings. Again, I'll make a call for our panelists if they have anything that came through the Q&A that they want to voice over for the larger group, or the KHB team if you all have anything to voice over for this group as well. Okay. If nothing else, we will stay on the line here for a few minutes if there are any sort of outstanding questions that you all may have. And as always, please feel free to stay in contact by emailing the KHB program inbox. It's khb.program@ky.gov. And you can also always reference their website as well. Lots of various resources, training materials, etc. That's available there. And that's khbe.ky.gov. So please stay connected. Thank you all for your time today, and best of luck as we quickly approach open enrollment. But as I mentioned, we'll stay on the line here for a few minutes. If there are any sort of outstanding questions, I'd be happy to address those as they come in. But if nothing else is outstanding, you all feel free to drop, and thank you for your time and have a great rest of your week. And further questions about future reference, this recording as well as associated presentation will be made available for your ongoing reference. And we'll stay online here for about 3 more minutes in case any other questions come through. So if you have anything, please feel free to drop those into the Q&A box. And I see Amy's question there about the um, government shutdown resource. Looks like I think Michael may be responding there to you, Amy, but Michael, correct me if I'm wrong, that's also accessible on the KHP website or Friday Facts as well.
It is. I'm finding the link. I'll drop it in chat for her.
Perfect. Thank you. Alrighty, everyone. I'm not seeing our numbers are dwindling down here and no more open questions. So, with that, I will close this out. Again, thank you to our panelists for your time and participation, and to you agents and connectors for all that you do throughout the year, but especially during open enrollment. Hope you all have a great day and a great rest of your week. Thank you for attending today. Thanks, everyone.